670 The Apple.
Good morning. This is your Smarter Heart University. I'm your host, Dr. Scott, and with me always is my co-host and partner at Change of Heart Cardiology in the beautiful Monmouth and Ocean County at the Jersey Shore, Dr. Robert Kaiser. Good morning, Bob.
Good morning, Scott.
These past few weeks have been challenging and fun for us. We've reviewed vitamins in the heart. We've reviewed alternative and complementary medicine, and recently we reviewed peripheral vascular disease. As far as I'm concerned, I think Smarter Heart University keeps getting better and better, and more of you are visiting our website, smarterheartuniversity.com, and listening to now 17 or 18 shows that we have up, as always, and you're getting updates regularly from our Facebook site. And basically, I've come up with this. If every one of you listening out there told one friend after listening to us just to go to smarterheartuniversity.com, sign up there, sign up on Facebook, imagine people how many heart ailments we can educate and maybe even prevent. And really, that's the final, we've always said if one person learns something from each of our shows. So enough said. Our popular question for this week, hey, doctor, should I get one of those newfangled CAT scans for my heart? Ladies and gentlemen of the jury, that's all of you out there, I submit to you that we are at the crossroads, a fork in the road between what is cost-effective and what is patient-effective in terms of diagnosing and preventing heart disease, between the old and the new, traditional but fraught with error, and technologically advanced but heavily debated. That's where we are. The crosswords here today basically are of the nuclear stress test versus the CAT scan angiogram and coronary calcium score to diagnose coronary blockages. Now, I'm going to avoid any political argument, but I feel compelled to make an observation that just 2 years ago, the CAT scans were much more readily and easily approved by a number of prominent insurance companies without much pain inflicted upon our medical staff to get quick pre-certification. Now, however, unfortunately, we have several hoops we have to jump through, and a couple of them, as I tell our patients, are lit on fire, but we still manage to get through those hoops. In all seriousness, I hope today we can provide some insight to all of you on this very highly debated issue, specifically the nuclear perfusion scans, which are a well-established modality and with well-supported guidelines to evaluate patients who have stable chest pain, or its most common use to diagnose patients who have suspected or known coronary artery disease. The CAT scans, on the other hand, have a growing evidence base, and they're becoming an increasing part of the mainstream cardiovascular imaging, as we will call this, using coronary artery calcification scans to allow us to assess the risk in people without symptoms, and CAT scan angiograms, contrast CAT scan angiograms, or cardiac CAT scan angiograms, to allow us to diagnose obstructive coronary blockages in those who have symptoms. So the principal difference between these two approaches is that the former is very good, those are the nuclears, very good to assess your short-term risk and possibly guide your physicians towards invasive revascularization, that's opening up blockages, and the latter really may provide a greater long-term assessment of your future coronary burden as well as future events, and therefore gives us insight towards a more aggressive lifestyle and medical preventative measures, because that's what Smarter Heart is trying to tell you every single week. Ultimately, which approach should be utilized depends on the specific question being asked and how all of you present. So if you have atypical symptoms and your risk is low to having heart disease, really no study may be required at all. Likewise, if you have classic symptoms and other abnormal findings like your EKG, no study may be performed, and you may be taken straight to the cardiac catheterization lab for an invasive revascularization, a stent, etc., a balloon. So, friends, the non-invasive test can provide useful information on assessing where and what is happening now and what may happen to you in the future. Which study is going to be right for you? is our main topic this week. And I make it short and sweet because Dr. Kaiser is level 3 certification as far as, and a co-director at Jersey Shore University Medical Center for coronary CAT scan angiograms and coronary artery calcification scores. And he's also a board certified nuclear medicine cardiologist. So, you're going to have a lot to say. I said to him as we were driving up, I hope I get everything right, and you agree with me all the way.
Yeah, well, that first part is certainly reasonable. It really gets to the debate of what study is right for you, and the two things, the nuclear scan and the CAT scan, are both non-invasive ways of assessing your risk of having a heart attack or having an event in the whatever time frame future, as well as trying to decide, do you have a blockage that we need to do something about in the cath lab right now? So two different questions there. And then also gets to what the scans look at. And we'll talk about this, I think, a little bit later,
Sure.
is actually what the scans are looking at. And they're two different things. One is looking at whether or not there's blood flow to the heart. That's a nuclear scan, whereas the CAT scan angiogram is actually a picture of the arteries of the heart. And so they're very different things that are looking at. And now, from a history standpoint, we're looking at nuclear scans are, I don't know, 20 years old at least.
25.
25 years old. I actually trained with Dr. George Beller down at University of Virginia for some of my training, and he is one of the founding fathers of this thing. And it's a very good, well-established study, a lot of data behind it. The CAT scans, as they started, and there's a lot of history behind them, but more really they came into their only in the past few years with the advent of the more advanced scanners, and the body of evidence is really building for the CAT scans, and like I trained again. I try to toot my own horn. I trained with some of the founding fathers of cardiac CT scans with Dr. John Runberger and Dr. Harvey Hecht at Lenox Hill. And the body of evidence for CAT scans is really growing.
It's growing, but the reimbursement is shrinking. I want to get to that point in a second. But callers, just so in case you're out there and you do have questions about this great topic we're going to discuss today, 1-866-970-9622, 866-970-9622. If you have any questions along this journey today, but that's you bring it up. And that's why I made that, try to make a politically correct statement that say, hey, listen, when these scans started coming out in 2005, we first learned how to utilize them correctly, who fits into what niche. And, of course, we're going to dissect that next segment. So stay tuned, everybody out there, because it's going to be important. We're going to go by and split up between nuclear stress testing and CAT scanning, and we're going to give you the indications, and we're going to finish with, where does it all fit in for you, or at least try to give you some scheme of where that fits in. But it does boil down to where we are currently in terms of government spending, government.
That's the two. We're
frustrating.
Dealing with the science of it, what should be done and what can be done from a science and physician and patient care standpoint. That always lags behind and especially nowadays with what's going on in Congress and the healthcare reform, that always lags behind. But what we can get paid for, and we want to try and steer away from that.
Of course.
We can't in this particular arena. We can't, because it's so intimately tied with what has to be what we would like to do. I mean, we would certainly like to do CAT scans, I think sometimes more often, but from an insurance standpoint, we're forced to do other things. And so, the two are intertwined at this point. But I'm going to try and steer and talk about what the science is and what the current thoughts are in the field of cardiac CT angiography and the field of nuclear cardiology for this particular talk, so that patients can talk with their physicians from an educated standpoint. It looks like we have a caller.
Yeah.
Do we have a caller?
Let's see. Emilio?
Yes.
Emilio from Yonkers. Hey, maybe, real quick, you have a question for us?
Yes, I was just wondering if this procedure would be ideal for me after having a cardiac MRI and multiple other tests to see why I continue suffering from AFib. I also had an ablation performed, but they didn't finish the ablation, the radio ablation. So I was wondering if maybe this this nuclear test can actually distinguish to see if indeed I do have a blockage, or is my problem with my heart more likely?
Well, real quick, we're going to mention the fact that AFib does put you at intermediate risk for heart disease, number one. And, of course, I urge you to go back and listen to our atrial fib show. Amelia, just hang on. I'm going to give Dr. Kaiser a quiz going out to our break. A primary function of nuclear stress testing is to determine who needs cardiac catheterization. Of those with an abnormal stress test, how many, 20, 40, or 60%, have only mild, less than 50% blockages at catheterization?
60%.
60%.
More Dr. Scott and Smarter Heart University is on the way on AM 970, The Apple.